You're listening to Health Professional Radio with Wayne Bucklar. Today my guest is Dr. Ben Fernee. Ben is the National Audiology Manager at Oticon, Australia, and Ben joins me from Sydney in Australia. Ben, welcome to Health Professional Radio.
Thanks, Wayne. Thanks for having me today.
It's a pleasure. Now, Ben, Oticon, Australia, tell us something about the firm and what it is that you do and what services you offer.
Sure. It's actually a really old company. It began in 1904 in Copenhagen, Denmark, and since that period up until now, the company has 30 subsidiary businesses in 30 countries, but also the instruments themselves, or the hearing aids themselves, are sold in over 100 different countries. So overall, we sort of focus our business on hearing aids, but we also make other equipment in the sort of hearing healthcare domain.
Right, that's a really big footprint if you're operating in 100 countries. Now, I understand you're one of the leading firms in research in this area as well.
That's right. We're really committed to research and development, and I think that's what's enabled us to have so much success in the industry. But just for an example, last year we spent over $140 million just on research and development, and we're the only hearing instrument manufacturer to have a dedicated research institution. And I'd like to tell you a bit about what we do up there later on.
Ben, given that Oticon is a big player in research in this area of specialisation, what have you been looking into, and how do you go about doing your research?
Sure. Well, we've got really close links with universities and other academic institutions, but we do have our own dedicated research facility called Eriksholm, just sort of north of Copenhagen there. But they're focusing on the three big mega trends in hearing research, and these relate to brain-computer interface. And here we're looking at sort of using things like the EEG to help steer the acoustical analysis hardware and hearing instruments. We're also looking at pupillometry, where we measure the diameter of a person's pupil as a way to record cognitive effort from moment to moment and then relate this to hearing. So that's in that area. We're also looking at another big mega trend is e-health or electronic health, and this is where we're using online resources for hearing rehabilitation, so doing sort of remote fittings and that sort of thing. And we're also looking at, which is really exciting, looking at advanced signal processing algorithms, and this is where it helps someone with a hearing loss to facilitate the separation of competing voices or competing noises, and also just helps them in sort of noisy environments where we know people with hearing loss really struggle.
And Ben, I just missed the name of that research institute. If you could give us that again, please.
Yeah, it's called Eriksholm, which is if anyone's interested to have a look what they're doing, it's K in the Eriksholm. But it's research facility just north of Copenhagen.
Love to hear about it. Mentioned hearing aids, but then you kind of drifted into other things as well. The range of instruments that you make extends beyond hearing aids?
That's right. We also make cochlear implants, a new device which you may not have heard of called a bone-anchored hearing aid, and we also make diagnostic equipment for not only investigating hearing but also investigating balance as well.
I see. And Ben, as someone in the media and not in the clinical field, the number of things I've not heard about in clinical matters is astronomical, let me tell you. Ben, given that Oticon's got such a big footprint in the industry, is there a message that you'd like clinicians who are listening to us today to take away?
Yeah, actually, we've got quite an exciting development that we introduced 3 weeks ago. We introduced a range of new hearing aids specifically for those patients with severe and profound hearing losses.
So when you say to me severe and profound hearing loss, in my ignorance, I'm thinking, well, a hearing aid's not going to help, but that's not the case.
Yeah, that's right. Someone with a severe or profound hearing loss, without their hearing device, they'll really struggle to communicate. So they're heavily reliant on lip reading they're also a challenge to fit with technology because they get used to the technology they're listening to, and any new development, it takes a bit of a longer transition period. But what we've developed is a new type of technology that enables us to bring sounds from the higher frequencies, which are generally softer type sounds like the S and the SH sound, and reposition those sounds to a lower frequency where it's more in the person's audible range. So it's a sort of unique approach that we're doing, but in the clinical trials we've done, we've had really favourable results.
That's great news to hear. And at the end of the interview, listeners, if you're interested in that technology, I'll give you a website to go and visit and find out more about it. I do want to ask Ben, before we run out of time, about cognitive brain hearing loss research. Now, I understand there's been some recent developments in this area.
Yeah, just this month in the American Geriatric Society Journal, a really interesting study was published. It was a 25-year longitudinal study, and it's made the link between reduced rates of cognitive decline in those people with hearing loss of the ones that are wearing hearing aids. So the bottom line is that as you get older, there's a natural sort of level of cognitive decline. But if you have a hearing loss and you don't do anything about it in terms of having amplification or hearing aids, you'll have an accelerated rate of cognitive decline, which is quite worrying. So really, the bottom line is that if you're aging, which we all are, and you have a hearing loss, definitely sort of do something about it, because the results sort of make a clear link between accelerated rates of cognitive decline and not doing anything about your hearing loss.
That's extraordinary research, really, isn't it? The two have never been much connected previously, as far as I know.
No, that's right, and it links to if you have a hearing loss, you're less likely to be engaged in sort of socialisation and other activities, and that in turn has an effect on sort of you withdraw from activities, and then that sort of influences your rate of cognitive decline. So really interesting research in this space.
It is indeed. Now, Ben, my favourite question in every interview, and I must say just before I get to my favourite question, there's much more happening in the field of hearing and hearing loss than I had imagined, so we'll have to get you back and talk to you again in depth about some of these matters, because we've just skimmed across the top today a little bit.
Right, thanks.
In every industry there are misconceptions, and my favourite question in every interview, what's the biggest misconception, amongst your colleagues, clients, patients, that is about hearing loss and that drives you nuts and keeps you awake at night?
Sure. I think it would have to be related to patients and reluctance to sort of get hearing aids when they first notice a problem. We know that the average sort of person takes 7 years from first noticing their hearing loss to actually getting a hearing aid. And the interesting thing was that in the research I was talking about earlier that was done in France with that cohort of over 25 years, the first signs of cognitive decline were noticed after 7 years in those people with hearing loss. So really, if you notice that you are struggling in background noise or struggling to hear voices, or you've got the TV turned up, go and get a hearing test and do something about it. That would be my advice.
It is one of those easy things to do, isn't it? There's no, the hearing tests don't require blood to be taken or things to be poked into you. It's easy to do and straightforward.
That's right. Yep, that's right.
Dr. Ben Fernee, National Audiology Manager with Oticon Australia, thank you for your time today. I do appreciate it, and I do appreciate the passion with which you speak about your topic.
My pleasure, Wayne. Thanks for having me.
It's been our pleasure to have you. And if you're interested in finding out more about Oticon, the website is www.oticon.com.au. Or if you've missed my interview or you've just joined us, we have a transcript on our website, and you can also follow the audio archive on YouTube and SoundCloud. The links to all of those resources are available on our website at www.hpr.fm. This is Health Professional Radio. My name's Wayne Bucklar.